Try to put the situation in the African continent into perspective. For more on this, a global health policy analyst and medical doctor Ayesha Jacub joins us now from Istanbul. Good to have you on the show. When you look at it, this is certainly not the first time that Africa is dealing with a public health crisis or public health emergency. Obviously, there was Ebola. It continues to be a threat, although as minor as it is. Give us a sense. Do you feel that the continent's previous experience will help the continent deal with this current virus outbreak?
Okay, so after Ebola, what we saw is that there was an effort by the African Union to put into place type of pandemic response unit, which goes with WHO's recommendation of country or regional specific pandemic response units. In Africa, our issue is resources. And I think this is the issue that we're going to face on a regional level, going down to the national level. I think Ebola put pandemic preparedness and put infectious diseases higher up on the agenda. But we can have policy, and we know that policy is only as good as its implementation. So we've got to take things down to a very national specific level. And we can roll out ideas of public health, we can roll out ideas of social distancing, but in reality, it comes down to what countries can do and what populations can realistically do. Now, if you look at the South African example, what we see here is from the national level, President Cyril Ramaphosa gave very clear indications that are in line with international recommendations, social distancing, travel bans, basic hygiene practices, but realistically, at a national level, we have a majority of the population engaged in informal labor. We have a large proportion of the population.
Doctor, sure. I'm sorry for interrupting, but I want to ask you. You talked about sort of resources is going to be the issue for Africa. During Ebola, it was only the African continent, or pretty much the African continent, dealing with this. With COVID-19, except Antarctica, this has spread to pretty much every continent around the world. Do you think, do you have the fear that Africa may actually take the back seat in this when the world tries to deal with this in terms of resources?
Well, it's a justified fear. Would that make it a reality? Because if we look at pandemic influenza, what ended up happening there is that there were vaccines available, but the cost of the vaccines made it inaccessible to African countries, despite we have, at that point, we had virus sharing, you needed to get a clear global sense. So we give information, we get the antiviral, but it's inaccessible to us because of costing factors. So the global inequalities play out severely when it comes to a crisis like this. So I definitely think Africa would take a back seat if it came to vaccine availability. Would there be widespread dissemination in Africa? Remains to be seen, but I'm quite doubtful.
Dr. Ayesha Jacub, thank you very much. I'm afraid we're out of time, but thank you very much for your analysis.